What if I told you that a single vitamin, one that most doctors rarely even test for, has been shown to reverse nerve damage in as little as 14 days, even in people over 60 years old? I know that sounds almost too good to be true. You've probably heard countless claims about miracle supplements and wonder cures. You may feel skeptical, and honestly, that's healthy. You should question bold claims, but stay with me. What I'm about to share with you is not internet hype. It's backed by clinical research, real patient cases, and decades of neuroscience that, unfortunately, mainstream medicine often overlooks. My name is Dr. Mandell, and if you've been dealing with tingling in your hands or feet, if you wake up at night with burning sensations shooting down your legs, if your balance feels unsteady, if your grip strength is fading, or if you've been told it's just aging, there's nothing you can do, this video might genuinely change your life. I'm not exaggerating. So please don't click away. Watch this all the way through because the information you're about to hear could be the missing piece you've been searching for. Let me paint a picture. Imagine you're 62 years old. You used to be active. You walked your dog every morning. You played with your grandchildren on weekends. Maybe you enjoyed gardening or light exercise, but over the last year or two, something changed. It started subtly, a little numbness in your toes. You blame poor circulation. Then came the tingling. It spread up your feet into your calves. Your hands started feeling clumsy. You dropped your keys. Buttoning your shirt became frustrating. Writing felt awkward. At night, burning sensations kept you awake. You shifted positions. You rubbed your legs. Nothing helped. You went to your doctor. They ran basic blood tests. Everything looks normal, they said. Maybe they prescribed gabapentin or another nerve pain medication. It dulled the pain slightly, but left you foggy, tired, and disconnected. Does that sound familiar? If it does, you're not alone. Millions of people over 60 are living with peripheral neuropathy, nerve damage affecting the hands and feet. And here's the shocking truth. The vast majority have never been properly tested for the one nutritional deficiency that could be driving the entire problem. The vitamin most doctors miss. The vitamin I'm talking about is vitamin B12. Now, some of you just thought, oh, B12? I take a multivitamin, I'm covered. That assumption is exactly what keeps so many people suffering unnecessarily. Here's what most seniors don't know. After age 50, your ability to absorb B12 drops dramatically. Your stomach produces less of a protein called intrinsic factor. An intrinsic factor is absolutely required to absorb B12 from food. So even if you eat meat, fish, eggs, and dairy, even if you take a standard multivitamin, you could still be severely deficient at the cellular level. And here's the scary part. Standard blood tests often miss B12 deficiency entirely. Your serum B12 might come back normal, but your nerves could still be starving. Why? Because the normal range is far too broad. Many neurologists and functional medicine experts now believe that the low end of normal is already too low for optimal nerve health. Why B12 is critical for nerves? Let me explain something fascinating. Every nerve in your body is wrapped in a protective coating called the myelin sheath. Think of it like insulation around an electrical wire. When insulation is intact, signals travel quickly, muscles respond correctly, sensation feels normal, balance remains steady. But when B12 drops too low, the myelin sheath begins to deteriorate. The insulation phrase signals misfire. That's when you experience burning, tingling, pins and needles, numbness. Weakness, poor coordination. If the deficiency continues long enough, the nerve fibers themselves can become permanently damaged. That's why early detection is crucial, the 14-day turnaround. Now here's the part that gets exciting. Multiple clinical studies show that when B12 deficient patients, even those over 60, receive the right form at the right dose through the right method, nerve improvement can begin in as little as 14 days. I've seen it personally. Patients who couldn't feel their feet report sensation returning within 2 weeks. People who hadn't slept through the night in months suddenly sleep peacefully. Balance improves, grip strength returns. It's not magic, it's biochemistry. Your body wants to heal, but it cannot build what it doesn't have the raw materials for. And B12 is one of the most essential building blocks for nerve repair. Not all B12 is created equal. This is where most people go wrong. The most common form of B12 in supplements is cyanocobalamin. It's synthetic, it's cheap, and it requires multiple conversion steps before your body can use it. For many people over 60, especially those with genetic methylation issues, it's simply not effective enough. The forms you want are methylcobalamin, adenosylcobalamin. Methylcobalamin directly supports myelin repair. It helps produce SAME, a compound critical for nerve regeneration. Adenosylcobalamin supports mitochondrial energy production, and nerves require enormous energy to heal. Ideally, you want both forms. Dosing matters a lot. The recommended daily allowance for B12 is about 2.4 micrograms. That's just enough to prevent severe deficiency disease. It is not enough to reverse nerve damage. Clinical studies often use 1,000 to 5,000 micrograms daily, sometimes higher in early treatment. For severe cases, B12 injections, methylcobalamin, 2 to 3 times weekly, can accelerate results by bypassing the digestive system entirely. After improvement begins, many people transition to high-dose sublingual B12, absorbed under the tongue. This bypasses stomach absorption issues. The supporting nutrients that make a huge difference, B12, is critical, but it works best in a team. Let's talk about the support players. Benfotiamine, advanced B1. Benfotiamine is a fat-soluble form of vitamin B1. It penetrates nerve tissue better than regular thiamine. It protects against advanced glycation end products, AGEs, toxic compounds that damage nerves, especially when blood sugar is elevated. Dose, 300-600 mg daily, extensively used in Europe and Japan for diabetic neuropathy. Vitamin B6, be careful here. B6 is essential for neurotransmitter production, but too much can cause nerve damage. Stick to 25 to 50 milligrams daily. Use P5P, pyridoxal 5-phosphate form. Avoid megadoses unless supervised. Alpha-lipoic acid, the antioxidant powerhouse. Alpha-lipoic acid has been used in Germany for over 30 years to treat neuropathy. Dose 600 milliliters daily. It reduces oxidative stress, regenerates other antioxidants, improves nerve conduction, decreases burning and numbness. It works both inside and outside nerve cells, uniquely powerful. Vitamin D, often severely low. Vitamin D receptors are found throughout the nervous system. Low levels are strongly associated with neuropathy. Target blood level 50-70 ng/ml, typical dose, 4,000-5,000 IU daily. With vitamin K2 magnesium, magnesium supports over 300 enzymatic reactions. It calms nerve firing, reduces inflammation, improves blood flow. Best forms, magnesium glycinate, magnesium threonate dose, 300-400 milliliters daily. Many seniors are deficient due to medications and soil depletion, the lifestyle factors. You cannot ignore supplements help, but lifestyle heals. Blood sugar control is essential. You don't need to be diabetic to damage nerves. Prediabetes and insulin resistance are rampant. Elevated glucose. Forms, ages, creates oxidative stress, damages tiny blood vessels supplying nerves. Action steps. Reduce refined carbs, eliminate sugary beverages, focus on vegetables, healthy fats, protein, monitor fasting glucose, A1C, and fasting insulin. Move your body. Exercise increases blood flow to nerves. It stimulates nerve growth factors. Even 20-30 minutes daily walking helps. Studies show moderate exercise reduces neuropathic pain by up to 30%. Start small. Be consistent. Prioritize sleep. Most nerve repair happens during deep sleep. Growth hormone is released. Toxins are cleared. Aim for 7-8 hours nightly. Address sleep hygiene. Dark room. No screens before bed. Consistent schedule. Manage stress. Chronic cortisol damages nerves and raises blood sugar. Practice deep breathing. Meditation, prayer, nature walks, social connection. Stress management is medical treatment for your nervous system, a real-life case. A 67-year-old retired teacher came to me, 3 years of worsening neuropathy, on gabapentin, told it was idiopathic, meaning unknown cause. Her B12 210, technically normal. Her methylmalonic acid elevated, her homocysteine elevated. Vitamin D 18, severely low. Insulin, elevated. Magnesium, low. We started methylcobalamin injections, benfotiamine, alpha-lipoic acid, magnesium glycinate, vitamin D3, plus K2, lower glycemic diet, 15-minute daily walks. Within 14 days, burning reduced 50%. 6 weeks, improved hand function. 3 months, walking 30 minutes daily, sleeping through the night. Off gabapentin under supervision. Every case is different, but the body's capacity to heal even after 60 is extraordinary. Your action plan test B12 methylmalonic acid homocysteine. consider 1,000 plus mcg methylcobalamin daily. Add benfotiamine, 300 milligrams. Add alpha-lipoic acid, 600 milligrams. Optimize vitamin D. Ensure adequate magnesium control. Blood sugar. Move daily. I am not telling you to stop medications. I am not telling you to self-diagnose, but I am telling you this. B12 deficiency is massively underdiagnosed in people over 60, and correcting it can change lives. Your body is not broken. It may simply be missing something essential. And when you provide that missing piece, healing becomes possible. If this gave you hope, hit the like button. Subscribe for more information your doctor may not have time to explain in a 15-minute appointment. Share this with someone struggling with nerve problems. Drop a comment below and tell me your experience. This is Dr. Mandell reminding you, aging is not the same as deterioration. Sometimes it's simply deficiency. Take care of yourself, take action, and I'll see you in the next video.